of hand. So the different small muscles of the hand, they are muscles of thenar eminence, then muscles of hypothenar eminence, then lumbricals and interossei. Now coming to the muscles of thenar eminence, what are the four muscles which are included in this category? That is abductor pollicis brevis, flexor pollicis brevis, opponens pollicis and adductor pollicis. So you can see these muscles over here. So this adductor pollicis has two heads. You can see in the diagram. So these are the two heads, that is transverse head and oblique head. So this is the transverse head and this is the oblique head of adductor pollicis. Now muscles of the hypothenar eminence, so they are the palmaris brevis, you can see, then abductor digiti minimi, flexor digiti minimi and opponens digiti minimi. Now coming to the thenar muscles first. Now before the discussion of the thenar muscles or thenar muscles, that is origin, insertion, nerve supply and action. So these are the carpal bones. So these carpal bones, they are arranged in two rows, that is proximal and distal. The proximal row is scaphoid, lunate, then triquetral and pisiform. So these four bones, they are forming the proximal row, and distal row is formed by, that is trapezium, trapezoid, capitate and hamate. Now coming to the origin and insertion of these muscles, that is abductor pollicis brevis is getting origin from the flexor retinaculum. Even flexor pollicis brevis and opponens pollicis, they are also getting origin from the flexor retinaculum. But the different bones which are contributing to the origin of these two muscles is, that is scaphoid and trapezium. So scaphoid and trapezium, they are giving origin to the abductor pollicis brevis, and trapezoid and capitate, so they are going to form. So this is the trapezoid bone and this is the capitate bone. Along with the flexor retinaculum, they are going to give origin to the flexor pollicis brevis. Both these muscles, they have common insertion, that is base of the proximal phalanx of the thumb. Then coming to the opponens pollicis, it is getting origin from the flexor retinaculum, but the insertion is to the first metacarpal. So this is the first metacarpal. So lateral half of the palmar surface of the shaft of first metacarpal bone is receiving the insertion of opponens pollicis. Then adductor pollicis has two heads, oblique and transverse head. The oblique head, you can see here, the oblique head is getting origin from the second and third metacarpal, you can see. So second and third metacarpal, base of the second and third metacarpal is going to give origin to the oblique head, and the transverse head is getting origin from the shaft of the third metacarpal. So these two fibers, that is transverse and oblique fibers, they fuse with each other and they are inserted at the base of the proximal phalanx of the thumb. So coming to the nerve supply of these muscles, so all these muscles, they are supplied by median nerve except adductor pollicis, which is supplied by deep branch of ulnar nerve, and their name is just giving hint of their action. That is, abductor is going to abduct the thumb, flexor is going to flex the thumb, opponens pollicis is oppose the thumb towards the finger, you can see. So counting of fingers, you can see. Then adductor pollicis is going to adduct the thumb. Coming to the hypothenar muscles, these are the four muscles. They are getting origin from the, you can see the majority of the muscles, they are getting origin from the flexor retinaculum, except abductor digiti minimi, which has additional origin from this pisiform bone. So this is the origin of the hypothenar muscles, and palmaris brevis is going to insert into the skin of the palm on medial side. So that is responsible. So when the cupping is formed with the hand, so wrinkling, it appears on the hypothenar eminence. So that wrinkling is because of the palmaris brevis. And abductor digiti minimi and flexor digiti minimi, they have the common insertion at the proximal phalanx of the little finger. So this is the proximal phalanx of the little finger. To the base of this, it is receiving the insertion of abductor digiti minimi and flexor digiti minimi. And opponens digiti minimi is going to insert on the medial border of the fifth metacarpal bone. So it is almost corresponding to that of thumb. If we just compare the origin and insertion of these muscles with those of thinner muscles, so almost the insertion is almost the same. That is, in that case, the opponens digiti minimi, it was inserted on the first metacarpal, and but in this case it is inserted on the medial border of the fifth metacarpal bone. Now coming to the nerve supply, so all these muscles of hypothenar eminence, they are supplied by ulnar nerve. But palmaris brevis is just supplied by the superficial branch of ulnar nerve, and rest of the muscles they are supplied by the deep branch. Now palmaris brevis, it wrinkles the skin to improve the grip. Abductor is going to abduct the little finger, flexor is going to flex the little finger, and opponens digiti minimi pulls the fifth metacarpal towards as in cupping the palm. So that opponens digiti minimi is doing. Coming to the next set of small muscles which are present in the hand is the lumbricals. So this word is derived from the Latin word which means earthworm. So the Latin word is there, which is the meaning of that is the earthworm. So these are 4 in number, numbered from lateral to lateral side. Lateral to medial side, we just number them. So they are 4 in number. So this is the first, this is the second, third, and fourth. Now, if we see the origin, so origin is from the tendons of the flexor digitorum profundus, you can see. So these are the 4 tendons of the flexor digitorum profundus. So first 2 are unipinnate, you can see, and the third and fourth they are bipinnate. So insertion is into the lateral basal angle of corresponding extensor extension. I will discuss that too. So they are going to insert on the basal angle of that dorsal digital expansion. Then nerve supply is first 2 lumbricals, they are supplied by the median nerve, and third and fourth they are supplied by the ulnar nerve. And the basic function of the lumbricals is they are causing the flexion of metacarpophalangeal joint and extension of interphalangeal joint. So metacarpophalangeal joint, this is the metacarpophalangeal joint, and these are the interphalangeal joint. So here they are going to flex this joint, and here they are going to do the extension of the joint. So this is the action of lumbrical. Next is interossei. So 2 group of interossei are there, superficial and deep. And superficial is given the name palmar interossei, and deep they are given the name dorsal interossei. First, we will discuss the palmar interossei. The main action of the palmar interossei is adduction of the finger. So you can just use this mnemonic PAD. P for palmar interossei, they are going to adduction, that is add, pad. So that is a mnemonic for the action of the palmar interossei. Now you can see the axis of the hand is just passing through the middle finger. You can see here. Now axis of the palm passes through the middle finger. Is it clear now? Here the axis is passing. It means this middle finger is considered as the at the position of abduction. So this is the abduction position. So hence it does not receive any attachment of palmar interossei. So we consider it as, or it is considered as in the abducted position, because the axis of the hand is passing through this middle finger. So it is not receiving any palmar interossei. So what is the action of palmar interossei? Adduction means they have to come close to the axis. So definitely if the interossei they will be present on these 2 rest of the fingers, they will pull the fingers towards the middle finger. So but this middle finger is not receiving any interossei, palmar interossei, sorry. So this arrangement is basically adding to its action. So these are muscles, they are inserted here. They are going to bring the finger close to the middle axis. So that's why the palmar interossei, they do the adduction of the fingers. Now coming to the dorsal interossei, the action is opposite to the palmar interossei. They cause the abduction of the finger. So you can remember or you can learn it by this DAB. D for dorsal interossei, ab means abduction of the finger. Now as I have told you, the axial line is passing through the middle finger. So abduction means the finger have to move away from this axial line. So the arrangement will be like this. You can see the axis is passing here. As the movement of the middle finger on either side is considered as abduction. So this middle finger is receiving the interossei on both the side, because they have to keep it in central position. So movement of the middle finger on either side, we call it as abduction, because it is moving away from the axis. So the interossei, they are inserted on both the sides of this, you can say, middle finger. So this is just giving a reference why the dorsal interosseae, they're causing abduction. The thumb and little finger, they have their independent abductors. We know it. That is abductor digiti minimi, then abductor pollicis brevis. So they have independent abductors, so they don't receive any interosseous muscle. So is it clear? I think it is clear because of the arrangement of the muscle in such a manner, they are just contributing to their action. So nerve supply is ulnar nerve. Action is flexion at the metacarpophalangeal joint and extension at the interphalangeal joint, that is proximal and distal interphalangeal joint. Now coming to the next topic, that is dorsal digital expansion. Now each extensor tendon flattens into extensor expansion over the dorsal aspect of the metacarpophalangeal joint. Now parts of the extensor expansion, you can see it is triangular in shape with base encircling the metacarpophalangeal joint on all sides except the palmar aspect. So this is the metacarpophalangeal joint. So tendons, they are ending into an triangular shape expansion, which is known as dorsal digital expansion. So the base is just present around the metacarpophalangeal joint. Now naturally the base, if there is there, then it has the basal angles. That basal angles, they are fixed to the deep palmar metacarpal ligaments. Now it has thick lateral margins which receives the insertion of single lumbrical muscles. You can see here. So thick margin, they are receiving the single lumbrical muscle, and thick axial part carries the insertion of tendon muscle. So this triangular area has thick lateral margin and it has axial, you can say, part which carries the insertion of extensor tendon. But in case of little finger and index finger, this part is also receiving the additional tendon from the little and index finger. So that tendons, that is extensor indicis, so that is extensor digiti minimi, so they are going to insert into this axial segment. The lateral margin and axial part, so definitely this is the lateral margin, this is the axial part. They are interconnected by the fibrous tissue near the base in order to ensure the firm anchorage of the extensor expansion at the back of the metacarpophalangeal joint. So they are just giving support to the extensor tendon, you can say. You can see here. So they are attached at the level of metacarpophalangeal joint. They are just encircling that joint. Near the proximal interphalangeal joint. Now this is the level of the proximal interphalangeal joint. So the axial slip, it splits into two slips. That is, you can see the two collateral and one central. So this is the level of the proximal interphalangeal joint. So they are going to split into two portions. So you can see here. Now the splitting, it happens. So these are the collateral slips. This is the you can say the one central slip. Now the central slip is attached to the base of the middle phalanx. So this is the middle phalanx. It is ending over here. And the collateral slips, they fuse with each other to form a single slip and going to the terminal phalanx. They also unite with each other. You can see here. So the two collateral slip, they fuse with each other and going to the terminal phalanx. So if we see the crux, this dorsal digital expansion is a triangular structure with thick lateral margin and central axial portion. This axial portion is receiving the extensor tendons, and this lateral margin is receiving the lumbrical, single lumbrical. So at the level of this proximal interphalangeal joint, so this axial slip, which is running in the center, it is splitting into two, that is two collateral and one central. So central is ending into middle phalanx and two collateral, they fuse to form a single one and going to the terminal phalanx. So united collateral slip cross the distal interphalangeal joint and attach to the base of terminal phalanx, that I told you. Now what is the action? The central and the collateral slips. So this is the central and this is the collateral slip. They just function independently. Now central slip is insertion is where, that is extensor digitorum tendon. So it is carrying the insertion of extensor digitorum tendon. So what is the action of that muscle? it is acting on the metacarpophalangeal joint. So it causes the it is just action is on the metacarpophalangeal joint, causing the extension of that joint. Now the collateral slip is carrying the insertion of what? That is lumbrical and interossei. So definitely these interossei and lumbrical muscles, they are going to insert where? So lumbrical is going to insert into this extensor digital expansion, but these interossei are going to end where? We have discussed that. So they are going to insert, depending upon their action, they are inserted on to the metacarpal, and their slip is extending to the extensor expansion too. So this collateral slip is just receiving the insertion of these two sets of muscle. So action is where? Metacarpophalangeal joint, proximal interphalangeal joint, and distal interphalangeal joint. So this is the action of this. So if a note come on the dorsal digital expansion, you are supposed to write its shape. You are supposed to write this, make this diagram. Then, so these are the different parts we can discuss, so that you have to cover, and action of these muscles. So this is all about this short lecture, that is the muscles of the hand.